Well, folks, good afternoon. As you can see, we have a little different setup today, just due to the COVID, little bit of an outbreak right now. We now have 151 assessment centers providing tens of thousands of tests each and every day across our province. And up to 60 pharmacies will be joining that group this Friday. But my friends, we see the numbers spiking up. It's extremely concerning, and we have to act. We always knew that a second wave was coming, and we've been preparing for months. Thanks to that work that we've been doing over the last couple months, and the minister gets all the credit when working around the clock, today I can announce that we're investing over $1 billion in expanded testing and contact tracing. That's $1 billion to support testing, and this investment will make a huge difference. But until we get Health Canada's approval for new rapid tests, rapid testing that other jurisdictions are currently using, until we get those rapid tests, the health experts are telling us that we need to be more strategic with testing. Earlier today, our top health experts told us we need to prioritize those who are at greatest risk. Starting today, they are asking people to only get a test if you have COVID-19 symptoms, have been exposed to a confirmed case, are a resident or work in a setting that has COVID outbreak, or a resident or work in an at-risk setting such as long-term care homes, shelter, health care. Folks, I want to reassure you, no one who needs a test will be turned away. Because it's all hands on deck right now, we need to be nimble. We need to listen to our health experts. This month, we've added 500 more staff for contact tracing and case management, and we'll be hiring another 500 staff on top of the 500. We're investing $30 million to enhance our outbreak management response. We have a robust surveillance and testing strategy for our schools and long-term care homes. My friends, we have the best minds anywhere in Canada working on this. We're sparing absolutely no expense. There's $1 billion on the table for testing. That's 1,000 more staff supporting contact tracing, $30 million to fight outbreaks, and $70 million for the largest flu vaccine campaign in Canadian history. And I'll have more to say next week about our plan to tackle the backlog of surgeries, protect long-term care homes, and fight surges of COVID-19. My friends, we're all in this together. We will spare absolutely no expense. We'll do whatever it takes, and together we will get through this. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. As part of our plan to keep Ontarians safe and ensure our healthcare system is prepared for future waves of COVID-19, our government is investing over $1 billion to dramatically expand our testing capacity. This means more testing locations and more case and contact management resources to trace and isolate cases. In doing so, we will also be supporting long-term care homes, schools, and hospitals to effectively prevent, track, and contain outbreaks of COVID-19. Our government has established a strong foundation for testing and case and contact management with lab networks capable of processing up to 40,000 daily tests. With this investment, we will significantly expand on that capacity, improving access to testing, reducing testing wait times, and ensuring Ontarians get the results quickly. We are also hiring more contact tracers to further expand our efforts to quickly identify potential cases. And we are going to look at how we can better communicate the importance and benefits of continuing to follow public health measures. We are working with Ontario Health, local public health units, hospitals, and pharmacies to expand testing locations based upon local needs. This will include more testing in new locations, such as your doctor's office, and at home for certain home and community care clients, in addition to the pharmacies that we announced yesterday in Huntsville. In support of these efforts, earlier today we released new testing guidelines to help focus public resources on where they are needed the most. These guidelines will prioritize those who are at the greatest risk while shifting away from untargeted asymptomatic testing. As our government takes steps to reinforce public health measures, we are also investing $30 million to prevent and manage outbreaks in priority sectors. Emergency Management Ontario has developed an outbreak guidance toolkit to support each ministry's outbreak management planning to ensure a strong response across all sectors. And we are also stress testing outbreak response protocols and structures through virtual simulation exercises that have been held across the province to address outbreaks in schools, universities, and correctional facilities. Additional scenario planning exercises will focus on Indigenous communities, long-term care homes, and retirement homes. Our government is taking the important, necessary steps to continue to protect the safety and well-being of all Ontarians. Our Keeping Ontarians Safe plan is an important step forward in our efforts to protect Ontarians from future waves of COVID-19 and to explain to Ontarians how we are going to do it. But again, ultimately, the best way to protect one another is the same advice that we've been giving to you all along: to maintain physical distancing, wash your hands frequently, wear a facial covering in situations where you are not able to maintain that physical distancing, and please stay home if you're not feeling well, even if the symptoms seem relatively minor. There's no doubt we are living in unprecedented times, but by following these simple guidelines, we can protect one another and beat COVID-19. Thank you.
Okay, we'll go to the phone line for questions. First question, please.
Your first question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hi, Brian.
Brian, your line may be muted.
Premier, I wanted to ask you about the throne speech yesterday and a lot of the promises that Prime Minister Trudeau. Much of it was centered around restriction, things like national pharmacare, national child care. Premier Legault already said he's not interested in that. Are you interested in those programs, and how do you feel about the federal government jumping into provincial jurisdiction in this way?
Well, I think, we speak from one voice, all the premiers. We don't believe the federal government should be in that provincial jurisdiction. We need their support, but no one understands healthcare better than each province. We all have different needs, and we were disappointed not to see any increase with the Canadian health transfers that were in desperate need. There was some other items we have to get more details on infrastructure and other areas when we ran through the throne speech, but nothing's more important to this country or every resident in this country than healthcare, and we need their support. And we don't need their support with conditions, and they're going to be taking over healthcare. If the federal government takes over healthcare, I think it'd be an absolute disaster. And every premier feels the same way, that they should not be stepping into the jurisdiction of the provinces.
Follow up?
On the issue of jurisdiction, Premier Pallister said last week that you don't renovate your second floor while the foundation is crumbling. Do you feel like without an increase that of healthcare will be crumbling? Does it put Ontario's system at risk if the feds don't step up with more money?
It puts tremendous pressure on every single province, including Ontario. We have the largest healthcare system. We're spending $67 billion a year. It's a massive, massive machine, and it's concerning when we've seen over the years, and it's not one government. I keep emphasizing this because I don't want people pointing the fingers at the federal government. It's the last 10 federal governments or 5 federal governments that have not increased healthcare spending. So as we've seen an increase of approximately 5 to 6% compounded every single year on healthcare, we aren't seeing that from the federal government. As a lot of provinces see anywhere from 20 to 22% support from the federal government, the burden of 78 to 80% of healthcare spending falls on the backs of the province, and there's no province that can sustain this. It doesn't matter what province it is. So we need their support. It's the most important item and issue that the people of Canada are concerned about right now, and we'd like to sit down and have further discussions on the Canadian health transfers with the Prime Minister and Deputy Prime Minister. I know they're concerned about it as well, but they didn't mention it in the throne speech, which is concerning to say the least.
Next question.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, Cynthia.
Hello, Premier. I'm wondering why yesterday you announced asymptomatic testing in pharmacies, and yet today then you said, no, not everyone who doesn't have symptoms should go there. And it's quite a reversal or a different approach from yesterday. Why didn't you do this all at once yesterday when it comes to asymptomatic testing in pharmacies, as opposed to, in 2 pieces? And many people are expressing confusion.
Well, there shouldn't be any confusion. I take the lead from our health table, our Chief Medical Officer of Health. We spent probably a couple hours on the phone last night, to be exact. I think it was 4 hours on the phone. Running through this, and I have to listen to the health experts. They're saying we have to make sure there's a priority for healthcare workers, educators, making sure long-term care staff are taken care of. And then I read your, I think it was a tweet about St. Mike's, and it's true what you mentioned, Cynthia. The more hospitals we're talking to, they're saying that close to 70 and sometimes 80% of the cases, people have no symptoms at all. They're anxious, and I understand that. I really do. I was the guy up here for months over and over again saying, get tested, get tested. Now, as we're ramping up with over 215 sites, including the 60 pharmacies, as we're going to continue to ramp up. And our message to the people is very, very simple. There's different groups. There's 2 groups. People that want to test, for getting a test because they feel a little more comfortable, and that's fine, or people that need a test. We have to focus on the people that need a test because of their jobs, or if they've been around someone that tested positive. Those are the people we want to focus on, and it's going to take a big relief off the public system. And the pharmacies will be open on Friday, all 60 of them, and we'll see the capacity they're able to put through there. And then we'll keep ramping up. We're spending over $1 billion on testing and contact tracing. We're sparing no expense at all. So that's the advice from the Chief Medical Officer of Health. And I stand up here every day and get questions from the media. The questions we were drilling down last night, it was nonstop. So again, I'll always rely on the health experts and science when it comes to the testing. If they're asking me to do this, I'd be pretty foolish not to listen to them.
Follow up?
Thank you. And today the Ontario Hospital Association released a letter on behalf of 38 physicians. They're calling on the Ford government, on your government, to restrict all non-essential business, including dining in restaurants, gyms, etc. Are you considering clamping down on certain businesses, if not across the province, but perhaps regionally?
Well, we're taking these measures until we don't have to do that. I think the more measures that we put in to keep the economy going and keep So the restaurants, and I've always said these restaurants are following the procedures and protocols. I think they're doing a great job. But in saying that, we're going to make sure that we review the numbers, and if it's a huge spike, everything's on the table. I will listen to our health experts, and that's who I'm going to go with the advice from. And it's not just one person; it's numerous doctors, health experts right across this province that are giving us the advice, epidemiologists and other experts. So that's who I'm going to listen to. But the reason we're doing this, we want to avoid shutting down the economy as long as we possibly can, because I think that'd be extremely, extremely difficult on a tremendous amount of people.
Next question.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Mike.
Hi, Premier Ford. I'm wondering why in the copy of the plan that I obtained, the government seems to go against the idea of moving back to stage 2. You said personally that you would not hesitate to impose a lockdown if necessary, but the plan seems to indicate that that would be avoided in favor of very narrowly targeted restrictions. What's the logic there?
Yeah, well, first of all, I think the copy of that plan was earlier on in the stage, and as we move forward, this is changing rapidly, and I will hand this to the minister in a moment. But again, I'll stand here, and if I get the advice from the chief medical officer and the health table that we got to go back to stage 2, then I'm listening to the health experts. We're doing all these measures to make sure we can keep the economy moving forward. We aren't at that point right now, but again, everything's on the table. So I'll pass this over to Minister Elliott. Thank you.
Well, we will do everything that we need to do to protect the health and safety of every Ontarian. And though we are taking these steps now, we're increasing our testing strategy and case and contact management so that we can identify and test, trace, and isolate to make sure that people are being cared for and we can protect the communities as well. We don't want to have to move back into stage 2 because that would have significant economic repercussions and cause additional hardship for people. But as the Premier indicated, this is a very fast-moving situation. We have seen a dramatic increase in the number of cases, and ultimately the safety and health of Ontarians is our top priority. And we are going to be listening to our medical experts, our public health experts, and if it's necessary to take other steps, we won't hesitate in doing that.
Follow-up?
My next question is about testing, in particular processing of all these new tests that are going to be done and the tests that are going to be done at the pharmacies. Where are you going to process these? Because there's some indication that you might have to be sending them across the border to the States. Why would you send Canadians tests for COVID-19 to the U.S. to be processed in a lab?
Well, first of all, Mike, we're utilizing every single testing lab there is in the province, and I'd much rather send it to other provinces if they have the capacity. We're trying to get lab technicians from the private sector as well that may not be involved in COVID, be it pharmaceutical companies. So the lab technicians, so shout out to them. We'd love to have you on board and support you, but it really comes down to the capacity of the lab technicians. We have enough areas that we can test people. We're going to continue to ramp it up. We're putting $1 billion into testing and tracing. So we're using every source there possibly is out there, and I don't care if it's private, public, or whoever it is, as long as we can get these tests moving forward. And we have a really, really good team doing this. So right now, that's not the case, and hopefully it won't be the case, but we put all options on the table.
Next question.
Your next question comes from Nicole Lampa with CTV News Kitchener. Please go ahead.
Hi, Nicole.
Hi, Premier.
Hi.
Thanks for taking my question.
Thank you.
Yesterday, Kitchener's drive-through testing site had people lining up as early as 4 in the morning, and by 7 it was at capacity due to safety issues, a major traffic jam, staff were threatened. The site shut down mid-morning, causing even more frustration. And to add to that, none of the 60 pharmacies to start testing for asymptomatic people are in Kitchener, Waterloo Region, and southwestern Ontario. What do you have to say to people in these areas who are frustrated, feel like they are being ignored when it comes to COVID-19 testing? And will you expedite additional funding to these municipalities where there are no pharmacies doing the test?
Well, it's a very good question. I addressed that with our team yesterday. We've mapped this out, and we will have pharmacies in that area to support the people of southwestern Ontario. And I just want to see how these go. The 60 that we had to put them in, as we say, the hot spots. But we're there to support the people in southwestern Ontario. I spoke to one of the local mayors there yesterday and mentioned that to him, that they're there. We will be there to support him. We'll be there as quickly as we can. And that, I guess, it goes back to the advice we got off the chief medical officers and more CEOs I've been speaking to at the hospitals. They're all telling me the exact same story. There's, as I said, Doug, there's people that want the test just for getting a test, and I understand that. And then there's people that need it. So what we want to do is reroute the folks to the pharmacies and take the load off the public system. And I think that's the right decision to do. And again, it came from our health team, and I'm going to listen to our health team. But the folks from southwestern Ontario, I'll have an announcement probably in the next couple of days on looking at available pharmacies in those regions as well.
Follow up.
What do you have to say to parents who have kept their children at home because they've got the sniffles or they've got a headache, and they're, now confused on whether or not they should go get tested after being told, hey, don't come back to school until, you've either got a negative test or, you don't have any further symptoms? Like, can you clarify and, provide some guidance? Will you be, I guess, changing the COVID-19 screening protocols at schools?
Well, before I hand it to the minister again, there's no one that's showing symptoms will be refused a test. And if you're showing symptoms and serious symptoms, please go to a testing assessment center. If you've been around someone with COVID and you're concerned, then we'd like you to go to a pharmacy. And I'll pass it over to the minister. Thank you.
Well, as the Premier indicated, anybody with symptoms that is concerned about their health or the health of their child, they will still be tested, of course. But we're also, in terms of education, we have hired over 500 public health nurses that are going to be working in our schools that will be able to help with some of the symptom management and issues to determine whether a child has simply the sniffles or whether it's something that's more complicated, perhaps flu, or ultimately COVID-19, to determine whether they should be tested. So these nurses are going to be a very valuable resource in our schools and help to determine whether the child needs to stay home or go to be tested, or whether they just simply have the sniffles, because as we know, young children often have runny noses. That it doesn't indicate that they're more significantly ill than that. But I think the nurses that are coming into the system will be of great help in determining these issues.
Next question.
Your next question comes from Randy Rath with CHCH-TV. Please go ahead.
How you doing, Randy?
Hi, Premier. You keep saying that we need Health Canada approval for a saliva-based test, yet BC is doing the testing presumably without Health Canada approval. Why can't we follow BC's lead and do the same thing and use the saliva-based testing before it's approved by Health Canada?
So we are on the UHN, and I'm going to hand this over to the minister as well. The UHN is doing it. Women's College Hospital is doing it, and I believe it's Mount Sinai is doing those tests. But there are certain tests, we call them, I'm going to generically say rapid testing, and rather than going back and forth nasal, and the rapid testing that we can get results immediately. Health Canada has had, I think there's 7 different types of tests that we can get results immediately. It's going to take a huge load off the public system if we can get this. And And I'm just asking them, please get moving on this and try to give us some help. That's what I'm asking for, really. So we have the BC test, but we need the overall rapid testing. And again, I think there's 7 pharmaceutical companies that submitted the rapid testing for Health Can to approve, and it's just been a long time. That was my frustration. Until we get this will be a game changer for everyone in Ontario. It will be a game changer for long-term care and healthcare workers and educators. If we can find out, you get a test immediately. It's just so important, Randy, that they get this approval moving. What I understand, they have a couple people working on this, and hopefully we'll get an answer sooner than later, because it affects everyone, absolutely everyone. When we can't get an answer, which is beyond me, if we can't get an answer saying we're doing the testing, we're going to be finished the testing on this day, we can plan around it. But when you're asking when are you going to get it finished and you get no answer, how do they expect us to plan properly moving forward? I just need to have a chat with someone over there and get them moving. At least, even if they tell us, Randy, it'll be a month down the road. That's all we need until we can start planning properly, because that was part of our plans. We thought this was going to be approved a long time ago, but some things take longer than others. So hopefully they got our message out there, and they're going to expedite this. I'll pass it over to the Minister of Health.
Well, we are absolutely waiting for the approval by Health Canada of some of the rapid tests. But as far as the saliva tests are concerned, we are running a program at the 3 hospitals that the Premier mentioned, where we're going to be running with patients or people who are consenting to this, to do both the saliva-based test plus the nasal pharyngeal swab, the deep test, to determine the efficacy of the saliva tests. If they turn out to be helpful and reliable with their results, then this is a type of testing that would probably be very useful to use in educational settings, particularly for younger children. It would be much easier to do saliva tests than to have to do the deep NP type of testing. So we want to make sure that these results are reliable. That's why we're running them in trials in the hospitals right now, and we hope to have the results very soon from that.
Follow up?
Last night, Prime Minister Trudeau said that Thanksgiving is done and that hopefully we can save Christmas. Do you agree with him? And Premier, do you have plans made for Thanksgiving yet?
You know something, Thanksgiving is a great time to get together with your family and your loved ones. We're just asking people to follow the protocol, keep it 10 people and under. Those are the new guidelines. And the quicker we can everyone follow the guidelines. We did it before and we were able to see the cases go down, and we just ask everyone for their cooperation. And it's such a special time for anyone to get together with your loved ones. And then at Christmas too. Christmas is always a big day in the Ford household, and we're going to do everything we can to make sure everyone has a great Thanksgiving and a great Christmas, because nothing is more important than family and loved ones getting together. But in saying that, we got to keep it under 10.
This will be the last question.
Your final question comes from Natasha McDonald with Radio Canada. Please go ahead.
Hi, Natasha.
Hi, Premier. City officials in Castleman are redirecting people to pharmacies all the way in Ottawa for testing because their assessment center is overwhelmed. Are you concerned about people from smaller communities, municipalities, heading to higher risk urban centers for testing? And when will testing be expanded to more pharmacies?
So I think once the 60 pharmacies open up and we can get a gauge on how many people they can get through there in a day, and plus the ramped up systems that we have on the mobile units, the community paramedics, along with the 10 pop-up tents, 155 assessment centers, and with a message from the chief medical officer and the health team today saying, if you aren't showing any symptoms at all, let's have a list of priorities And I know people want to do this. People want, if they have a loved one in long-term care, they know that the PSWs, they should be in front of the line. They know healthcare workers have to be at the front of the line, paramedics have to be at the front of the line, and educators have to be at the front of the line. And if you just aren't showing any symptoms and you're nervous, the chief medical officer is asking us to get the message that folks don't basically go to the assessment centers. We have the pharmacies being ramped up, and again, the question about when can we see more. Let's just get a few days underneath our belt, see how it goes on these pharmacies as hopefully they are. I'm confident they are going to go well, and then we can ramp up more pharmacies. We're putting $1 billion into testing and contact tracing, and that's a tremendous amount of money. We're hiring upwards to 1,000 people to support us in that area. So I think if everyone follows the guidelines again from the chief medical officer and their ask today, I think we'll be doing well.
Follow up.
So your goal is 50,000 tests, but per day. But your government agreed to a capacity target of 78,000 tests a day under the Safe Restart Agreement. So I'm wondering, when are you planning to hit that target, and has the federal government given you a deadline for this goal?
No, they haven't given us a deadline. I had a long conversation with the Deputy Prime Minister about that. She knows that we're leading the country. We're hammering out the tests. And again, I just want to point out, every province, every person outside of Ontario, with all the resources they have, they still aren't keeping up to Ontario. We're hammering out the tests, 38% of the population, 52% of the tests, 3.6 million tests, close to 35,000. So the structure's in place, and we're going to continue ramping up until we hit our first target of 50, and the Deputy Prime Minister understands that. And I'm sure, and she never said this, but I'm sure she's probably thinking, I know her well enough, I wish everyone is doing as well as Ontario when it comes to the testing. I'm going to be on the COF meeting, Confederation meeting with all the premiers today. We'll have that discussion. We'll also have the discussion about not hearing anything about the CHT when it came to the throne speech yesterday, which is very concerning. If we have to continue ramping up the testing, it puts a real burden on the healthcare system as a whole, and we need the support of the federal government to step up to the plate, and they've been doing an extremely good job in supporting us with the Safe Restart, and they're very understandable, and they've been very collaborative, and we just want them to help us out on the Canadian health transfers. It's so important. And again, Health Canada, please get those tests going. It's going to be a game changer for the entire country.
Thank you.
Thank you, everyone. Thank you.